Good afternoon, everyone. Time is now 4:10, and I call to order the meeting of the Health and Mental Health Committee. A copy of the agenda for this meeting may be found on the county website under the tab for Legislature. Please silence your phones and electronic devices. And at this time, I ask you to please rise and join me in the allegiance. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Take roll, please.
Absolutely. Amo,
Here.
Benelli, Ellers,
Here.
Stellar, Ramos,
Here.
Sutherland, here, Chewy,
Here.
What's
Here.
Present, back.
First up on our agenda is Lacey Trimble, Commissioner of Social Services and Mental Health. Hello, Lacey. Item A, request to accept and appropriate state funding from the New York State Office of Mental Health and the New York State Office of Addiction Services and Supports, OASAS. This funding is comprised of $26,744 for COLA, $48,100 for the vet-to-vet program, and $31,388 for the medication assistance treatment program. $106,232. Legislative request number 215. Can I have a motion?
So these funds are funds that were received through a funding letter from each of the state offices, primarily to add additional funds to existing programs. The one that is a little bit new is the additional funds for the medication assisted treatment. We do have pass-through funds that we provide to the Orange County Jail for them to provide substance use disorder treatment. The state across the board was giving additional funds specifically for the medication piece in jails to help offset the cost of those medications because they are very expensive. So that will be passed through to the sheriff's office for the jail.
Do you have any questions? All in favor?
Aye.
Any opposed? Motion carries. And item B is the monthly department update.
Our court navigator has officially started. I brought forward the funding for this a couple of months ago. We were able to hire the staff person and they have already started working in the courts. They're working towards streamlining processes to help those individuals who are involved in the court system for criminal issues with have a mental health diagnosis or substance use disorder, and getting them into treatment may hopefully reduce recidivism. She is working in that, which we are very excited for. I just wanted to touch on, there are 2 suicide prevention trainings coming up, Safe Talk Suicide Prevention and Mental Health Resource Training. That is being a collaborative offering through our Suicide Prevention Committee and the Orange County Youth Bureau. And Question, Persuade, Refer, QPR, which is also suicide prevention training that Access Supports is offering. The flyers for both of those are attached along with the information on how to register. Our county operation, we have our OMH recertification visit happening right now. They've already been to Port Jervis. They are going to be in Newburgh this week. I have no concerns. I think they are doing very well so far. Our feedback has been very positive. They've interviewed some of our clients who are very happy with their services. So I think we will get an overall good report from the state on our clinics and receive a full license. So that is our hope anyway. Satellites, we received the certification for Cornwall Middle School, Cornwall High School, and Truman Human Elementary School. I'm hoping that we can find some great social workers and get them started and hopefully get it started up for the beginning of the school year. We've had some really good success with recruiting some of our former interns into the programs. So we are working with the school and getting those posted to hopefully fill them. And then below is your data. The satellite services are down slightly, which is normal for this time of year with the kids not being in school. They're a little harder to catch than they are when in the school building, but we're still seeing year over year increases in services. I would not be surprised if our clinics exceeded 40,000 services this year, which is a record number of services for our programs. Corporate compliance, the only update we have is we had one self-disclosure required in June after, again, finding a client whose insurance changed and we didn't notify, we paid that back. But under the new regulations, we do have to self-disclose those to OMIG every time that happens.
Just a quick question, this required, do you have any more of a social media friendly, that you could send to Doreen to share with us so we can share it on our social media? Or do you have a social media post for this? That
I'm sure we can come up with something.
we could, yeah, just so we can share it. And then, last month I had mentioned to you about coming up with some ideas for September. And I'd like to still get that rolling. before September rolls around. In addition to this is great.
We're trying to do at least one training every month around suicide prevention. But yes, we can definitely do that. I've asked the suicide prevention committee to start thinking of either planning individual events or joining things like farmers markets and other things where there's already tables to put the information out there.
Are they gonna be out for National Night Out also?
Yes, there will be information out, not always on their own table because it's not a huge committee and there's so many, but we will have information spread across multiple tables through multiple departments and our contract agencies.
Yes, I'm participating in the Highland Falls one, so if you provide me material, I will definitely put that out on our table. I don't know if anybody else here is participating in their local national night out. So I ask that if you are, if you would please take information and help the committee spread the word a little further.
Be happy to provide
Because your life saved is only worth fair enough. Thank you. Anybody else have any questions? Thank you, Lisa. Thank you. Great trip. Next up, we have Dr. Jennifer Roman, Medical Examiner, Acting Commissioner of Health, Lisa LaVive, Deputy Commissioner of Health, and Gretchen Reardon, Department Deputy Commissioner of Health. Hello, ladies. How are you?
Good afternoon.
So for you, we have simply our monthly update.
No, it's probably at first, I'm very, very. Not asking for anything. So we've had a good month in the health department. We are in the process of finalizing our training of our new LPNs and public health nurses. And we do believe that by August, we will have our clinics back up to where they were before this loss. So we will have our regular sexual health, tuberculosis, and children and adult vaccination clinics back online in Newburgh and Middletown. As a part of that, this is that time of the year when the health department will be putting out some information for parents to resurrect or dig up that letter they got from the school nurse at the end of the year in May or June to get their children vaccinated in time for the beginning of school so that there are fewer excluded children. We will be, we are planning on having extended clinic hours to allow for more children to be immunized in our clinics. We do only immunize uninsured or underinsured children. So the children whose families have health insurance would need to still go to their regular provider. And for intervention services, our parent and child play group continues at the Armory on Tuesday mornings. The focus group of this is children aged 0 to 5. We had a special guest author last week. We have the preschool education enrollment is listed here for you. We are also met today out in Newburgh with Office for the Aging, and we're going to be working on a intergenerational play group in the Newburgh Armory on another day of the week. So there'll be two.
That's, yeah.
So we're very excited about that. Our Children and Youth with Special Healthcare Needs program was recently visited by Dr. Corey Green, who runs the Center of Excellence for our regional CHIS program. And she was very pleased and impressed with the number of families that we have now enrolled in the program, 436 so far. It far exceeds neighboring counties and the services that are provided by them. We did the trip to Legoland. We may also be doing some other events coming up.
Sure. We continue to have the same 21 active grants for 2025. We are averaging a 95% spent down on our 25 grants. We will be getting the dual funding. Our first installment should be around 517,000. I did hear back from the AG's office, though we thought the funds had all been distributed, that they're still experiencing delays, but we do expect to be getting that money shortly. And then after we receive the initial installment, we'll get subsequent installments each year of about 172,000.
The H5N1 emergency for the CDC they have stopped considering that an emergency. This is the H5N1 virus that have been found in dairy cattle and in dairy milk. And some people have been infected with H5N1 from their work in dairy farms. New York has been identified as not being affected by this this emergency. So it's not really going to change anything for us as far as the dairy cattle and the human transmission. If we have an outbreak among migratory birds, we'll address that. But the emergency for that is over. Measles is still, I know we've talked about this before, I'm not going to read this, but measles is basically all over the world. We've had more cases in the United States as of July 9th than we've had in any year since 2000. In the United States, we have had cases here. We do not have any cases currently, but since measles has become something that people are aware of again, we do follow up with any kind of suspected measles. And right now it's sort of like if the doctor sees a rash, they're going to test for measles. So we're following up on that. We're working with local hospitals for our community health assessment. There is a, if you go back to your digital copy of this, there's a survey. If you haven't completed it, I encourage you to complete it. It's a community assets, so what our strengths are and what we need more of. And I would suggest, please feel free to share it widely. The more responses we get, the more information that we have. And members of the health department will be going to events like National Night Out, farmers markets, and things like that to also collect survey answers from people who don't have access to the internet. We are seeing an increase, and I gave you some statistics there in rabies. We are having more people being bitten by stray cats, I guess they're their nature stray, raccoons, and other types of animals and bats. So we encourage people who think they have been exposed to rabies or exposed to a wild animal to please contact the health department. And if they need treatment, to mention that when they go to the emergency room. And we do have a nurse on call 24 hours a day who can authorize rabies prophylaxis treatment. The other thing we sort of look at this time of the year is the tick bites and the incidence of ticks. We sort of are not now having a break from ticks. Ticks seem to be almost a year-round thing because of the warmer winters that we're having. The Lewis Calder Center at Fordham University publishes a tri-state tick risk index. And the risk, which is basically the risk of being bitten by a tick. And right now, it's a 9 out of 10 for our area. So if you're going outside, a lot of people, when they're going on a hike, they'll take precautions, they'll wear the long pants, they'll tuck their pants into their socks and do all that. But a lot of times, just going out to the mailbox, or taking the dog for a quick walk or something like that, you don't think about taking precautions. But with the chance of getting bitten by a tick being so high right now, I encourage people to take precautions anytime you're outside.
So what is considered a tick bite? I mean, when they climb on you and they stop, it takes them an hour or two
Yeah.
or more to like chew
Yes.
and get in.
Right.
So I went hiking on Sugarloaf Mountain a couple weeks ago and I caught one here and, it came right out, no problem. Is that still considered a bite because it was attached? Or does it have to be when they really start to blow up?
So I would encourage, because there are different kinds of ticks and their transmission is at different rates. So I'm hoping that you wouldn't leave it on till you got engorged. But if you take it off and you're able to remove it completely, I would note it in your phone or on a calendar. And then if you get sick, you'll have that information to give to your doctor. A lot of people forget that they were bitten by a tick. And they also say it's not the tick you see, but it's the tick you don't see.
Right.
So if you had one, you might have had another one in a place that, you didn't actually, you weren't actually able to remove it. We do have tickets at the health department and we take them at a variety of events and distribute them. And we also distribute them to just about everybody at camps, children's camps, especially overnight camps.
Yeah, you brought the good ones here once. A long time ago.
But yeah, I think that, those kinds of things when you're out, there's clothing that you can buy that has a chemical in it that repels ticks. And then to use the, if you're able to use it, to use the deep woods off or something like that to protect yourself. So there, besides Lyme disease, there are a bunch of other things that you get from a tick. So you
Thank
might be good. Let's see. Our environmental health revenue collected through June was $444,778, which is trending above budget projections. We also encourage people to take steps to prevent being bitten by mosquitoes. We have started our mosquito surveillance project. So what that is they take samples from different ponds around the county and send those specimens to Wadsworth to see if there's any West Nile or Triple E virus in the sample. And we just had our first set of results and there was no West Nile or Triple E found in the samples that were taken. We also encourage people to keep your grass low, empty all receptacles on your property that can hold water, just to prevent mosquito propagation. The health department also hosted 2 trainings in June. The engineering division did a training for small water systems operators so that they understand the requirements of being a water operator. And also the second one was for the Professional Engineering Society. This is one of the things that we did as a result of the big engineering plan that we had submitted here before. Both were very well attended and well received. We have plans to do more of those in the future. You'll see at the very bottom of the second page that we've had this year 352 plan reviews through the end of the second quarter. This, of course, puts us on track for almost 700, which will be a record high. We used to have 352 a year, and this is 352. There's some more statistics there. For emergency preparedness, our director is currently in Alabama attending a training about the national stockpile and the effects that the cuts the federal budget will have on the strategic national stockpile. I expect that to bring here next time some recommendations that the county may want to consider as far as what we should have here in the case of an emergency. We do have a very active medical reserve corps. This is a volunteer group that assists. You'll see them at Freedom Fest, you'll see them at all kinds of county events, but they also helped vaccinate people during COVID. And you can sign up for that on the health department website. And we are working on a tabletop exercise after the fire in the nursing home, I believe it was in Massachusetts, to plan evacuation strategies for those types of facilities. The medical examiner's office.
Excuse me, before you get into that question.
Yes.
We saw a report recently in national news about the peak in COVID summer peak. National, report, I know it's not here. What raises questions for people like that? What's the current standard on what is a booster period? I hear people say that 24, 25 is good. Is that what you're talking about? Is there a booster coming up in September? Do we know anything about it?
There's really not a lot of information that's coming out of the CDC or ACIP as far as recommendations about COVID vaccinations at this point. There's been a dramatic change in the ACIP membership. The 17 members were dismissed, and so we don't have any information at this time about any new vaccine or like a directed vaccine like you would see with flu. But I can certainly see if I can find some information and send it to you, but I know we've not heard a thing.
I think it'd be useful to get it out if that's what's happening.
It would be, although right now the Orange County COVID numbers, RSV numbers, flu numbers are extremely low. But if we do hear that there's going to be a new vaccine or recommended vaccine to get this fall for certain age groups or certain types of people, then we can share that information. Okay, so the medical examiner's office, we've transported year-to-date 205. I just got some information from last week. 205 decedents to the medical examiner's office, and we have they have performed 152 autopsies year-to-date at the end of last Friday.
Joe?
When you have the different categories, you have the autopsy,
An
And then-
external exam.
external exam, so what's that just, you just tell us the different types of tests these are?
So an autopsy is going to be both internal and external to establish the cause and manner of the decedent's death. An external exam might be either a confirmatory test where just the body is examined but not cut into.
Okay, then what's no case?
A no case might be a phone call that that the investigator is making. Someone's making to the investigator, and the investigator is contacting the medical examiner about whether or not there are specific types of deaths that the decedents have to come to the medical examiner's office. Unnatural, accidental deaths, they're all specified in county law. And so in some circumstances, you might have maybe a death that was unattended, but the decedent has a medical provider and has had a long history of a chronic illness.
It seems like that's a big category.
It is. So the investigator goes to the scene and reports back to the medical examiner, and we decide the person doesn't need to come to the medical
And
examiner.
then certs,
So those are just certifications of deaths, yes.
that's low.
Usually
their
Usually,
own doctor or something. else does it.
yeah, somebody else does that. This might be in a case
Is
where,
there a body hold? That's the last one.
so there, unfortunately, there are times when people die in Orange County and they have no family. And it takes a considerable amount of time to locate a family member who will be taking care of the remains of the person. Or we may have to apply to the county to bury the remains of the person. And so we may be in a situation where we have to hold the body. Sometimes also there are disputes within families as to what the disposition of the remains are going to be. So we will hold the body until that's resolved.
Okay, thank you, Chairman. Thank you.
Okay. So our ATUPA program, which is the Adolescent Tobacco Use Prevention Act, there's some information about the number of inspections that we're doing. We are required under the ATUPA law to inspect all licensed tobacco facilities. We also do, we check and make sure they have the required documentation license, but then we also do underage inspections to make sure that nobody's selling tobacco products to people under the age of 20. In the second quarter, there were 25 violations among tobacco stores in Orange County for a sale to an underage person. And we do receive some issues about flavored vapes, which are illegal for everyone in the state of New York. There's a little bit of a loophole in the law in that if you're not registered to sell flavored vapes, we can't actually do anything. So you can see where that's going. We also have in our community health outreach, we have a pregnant or parenting people's initiative for the POPPY program. In quarter two, there were 54 new referrals. And this is a referral-based program for home visits to improve the health outcomes for at-risk moms and babies. And the childhood-led prevention program has a 16 new cases in 2024. In the first quarter, in 24, in the second quarter, and our numbers this year are much.
Any questions? Thank you both very
I
much.
just have one quick. Just with the early intervention, so I thought this when we were going over that. How is that working out with the state and all of the troubles that we had at the end of last year?
Other than EI Hub,
Yeah.
there has been some improvement. We have had a lot less complaints. The problem now is that the state has cut the rate for telehealth visits to the providers. So that is presenting a problem because we're losing those providers since they're cutting the rate.
Yeah.
And we've already had a provider issue. There should be some increase. There's supposed to be a 5% increase to all providers and also a 4% to underserved populations. So hopefully that will help us to attract some more
What's that
providers.
do with the next budget?
That it should have already been in effect,
Oh,
and that's
so
the
you
thing,
could
we're
have
just
it.
waiting for the state to give us the data
Okay,
when they're
great.
going to.
Thank you. Thank you, Chairwoman.
Welcome. Next up, we have Lawrence Ledoux, Commissioner of Valley View Center, and Donna Strecker, Director of Finance, Valley View Center. And Donna's flying solo because Lawrence is still entertaining the state, shall we say.
Yes, they are planning their exit interview, hopefully within the next hour or two. Department of Health is on site for a survey.
Oh,
Our last survey was in June 2023.
So first up, we have item A, requested supplemental appropriation of funds for the proposed 2025 capital expenditure for the replacement of kitchen ceiling tiles as recommended in the Facility Conditions Assessment, FCA report. The ceiling tiles in the dietary kitchen have deteriorated and replacement is a necessity to ensure safe and sanitary conditions. This is a proposed capital project number 154 in the 2025 capital plan. Upon approval, a new capital project will be created in the amount of $22,500 bonding. Legislative request number 210.
So
This was a project that was identified in the facility assessment. It was a priority one project, and so we're submitting it for consideration.
Any questions? All
I,
in favor?
Aye.
Any opposed? Okay. Next, we have item B, request supplemental appropriation of funds for proposed 2025 capital expenditure for the replacement of specialty wheelchairs. The New York State Department of Health and the Center for Medicare and Medicaid Services mandates nursing home operators to provide appropriate mobility devices to maintain residents' highest level of functional independence within a nursing home environment. This is proposed capital project number 144, the 2025 capital plan. Upon approval, a new capital project will be created in the amount of $65,000. Bonding legislative request number 211.
So moved.
second,
Okay, these wheelchairs, about 16% of the Valley View residents use specialty wheelchairs. It's a jerry chair that one of them is a jerry chair that when they have problems sitting up, it allows them to recline and sit upright. A rock and go chair as well. The average life expectancy for these types of chairs generally is around 5 years, depending on how often they're used and the terrain that they're used on as well.
Any questions? Question, all in favor?
I,
Any opposed? Okay, next up, we have item C, request supplemental appropriation of funds for a portal generator for the wastewater treatment plant. The New York State Department of Environmental Conservation and the United States Environmental Protection Agency require that the facility provide a backup electrical power source to the wastewater treatment plant in the event of normal utility electrical power loss. Operational continuity of the wastewater treatment plant equipment during loss of normal electrical utility power ensures consistent, efficient quality, and that effluent limitations remain in compliance with permitted limits. The wastewater treatment plant outfall discharges into a tributary of the Walk Hill River, and the completion of this project will ensure the continued protection of the receiving waterway and protect public health. This is not in the 2025 capital plan. Upon approval, a new capital project will be created in the amount of $117,230 bonding. Legislative request number 214.
So this is a project that was not presented in our 2025 capital plan. Right now, we are actually, to be in compliance, we are actually renting a generator. So we'll purchase this and replace that generator. We've been renting it for the last 3 months. So it's almost just under $9,000 for the rental.
You have to know if it's propane or if it's gas,
I think it's gas.
and the one you're proposing to get is.
I believe I was reading this is also gas as well. Yeah, the permanent unit would be a sub-base fuel tank. I think the one that we elected was the portable for 100,000, and I think that's gonna be hardwired.
Yeah, it will be hardwired with what's
hardwired.
called the generator transfer switch, but the power source for that generator would be either propane or
I
gasoline.
think it's gonna be gas.
Or- Thank you. Any other questions? No. All in favor?
I,
Okay, carries. The monthly financials are up next.
The financials we're reviewing today are for as of year-to-date through June 2025, reconciled to the general ledger as of 7/17. There's been no change to the IGT funding reported. Appropriated surplus posts at year end, depending on the gains or operating losses of the facility. Other revenues coming in at 17.2 million. On the personal service side, we've expensed 10 million $696,000. That encompasses personal services, payroll expense, overtime, per diem expense, equipment. We've encumbered 29,000. We've only expensed 9,000 at this point. The indirect costs will post at year end for county services. Employee benefits, we're coming in just under 8 million. And serial bond interest at 30,048. And if you turn to the next page, you should see the analysis that looks like this: payer source days and census. If you go over to June, you'll see that our Medicaid population for June was 80%, small amount of Medicaid HMO, and Medicare at 12.16. So our census based on 360 beds is 6,202. We recently closed another 30-bed unit due to the complexities surrounding staffing. We are operating right now at 240 beds, and our census based on that for June is 90.78. And the next is a historical. So the DOH has been on site now for a week. We expect them to exit sometime within the next couple of hours. The environmental surveyor may be on site for a little bit longer. They usually come in at the end to do all the environmental surveys of the plant. Valley View census on July was 62.22 based on 360 beds. You know that we're at 93.33. For June, we had 28 admissions, 13 new and 15 readmissions, 5 deaths, 6 discharges to the hospital, and 14 discharges to home. Valley View census is 13. She had 11 new admits, 8 discharges, and 159 clinical treatment sessions in the community. Lawrence has received the results of the New York State Department complaint survey. They were on site. I think of the exact date when they were on site. I think in June, maybe. We did receive 3 deficiencies, one for residents' rights, staffing, and the facility assessment. He reported that they are minor deficiencies in scope and severity, and he's already submitted a plan of correction to the New York State Department of Health.
Anybody have any questions? Yes, so
I'm just wondering, when you anticipate having the results, at least given the environmental survey, so that you get on this agenda.
And then one that's occurring right now. They usually take a fair amount of time because, as you know, the report is pretty extensive, and I would say it'll probably be at least a month.
Madam Chair, I'd like to see if we can possibly get that on the agenda for this committee. That when the report comes in, if they come and present it to us, so we can read it, look at it.
Can you let Lawrence know that, please?
Yeah, I will.
Question, another question, you may not have this information, but we're hearing there's a spike in overtime at the state level, hearing a lot of information like that. What's the status of the payment and the percentage of how many places people are on payment?
I can give you more statistical data. We do track FEMA. We track it by employee and number of occurrences and et cetera. So I can give you a high level, and some of that is HIPAA protected. So it'll just be a high level, more or less, of like, sometimes I look at the shifts that experience FEMLA. I look for patterns. Which shifts experience the most FEMLA? Is there a pattern of, possibly people calling out and calling out always on the weekend? So we do have that data.
Okay.
So I can give you a high level.
Thank you.
Sure.
Legislature?
With we had 28 admissions, 13 new, 15 readmissions.
Yeah.
How does it, when you do have a readmission, is that someone having a relapse, or is that someone that's already been under Valley View's care? And is there a time limit on it, if they were on the Valley View Care, when they could get back in as a readmission without going through the whole process?
Generally, the readmissions that you see there, those are people under our care that may have gone out to the hospital due to some clinical changes.
back.
And then back in again. They couldn't be, they couldn't be treated in place, so they're sent to the hospital. Sometimes they don't actually get admitted.
Yeah.
There's an observation period within the emergency room, and so sometimes they just launch them in. But that's what we're talking about. Yeah.
And,
We still have a waiting list.
How long is that?
I'll report on that in the next meeting. I believe the long-term care beds was 50.
50.
Yeah.
Usually seems to be that.
Since we closed the other unit, most of our long-term care units are just about at capacity. There might be like 2 or 3 beds open.
Yeah.
Yeah, so because we closed that other unit, we're pretty much at capacity.
And then they're long-term, so there should be some movement on it as they expire.
Yeah.
And that
Yeah.
opens up.
That's,
Unfortunately.
we've had a pretty strong census on the short-term rehab unit. Staffing, our biggest need right now is LPNs. And on the weekends, we experience a lot of issues. We meet every single day to talk about staffing. So we have, I think it's a 50% vacancy right now with our LPNs. We have 32 full-time LPN positions and 14 of them are vacant. And the LPNs play an important role in the delivery of care. They work on the units and they deliver medications and do assessments. So we are partnering with county HR and hoping to come up with some more solutions.
Well, thank you.
Thank you.
Chair.
I just said, it's just, sorry. Maybe just, maybe you can help me in case I understood it correctly. But when I looked at the auditor's report that they gave us last month.
Yeah.
The one thing that struck me is that it sort of talks about the future of Valley View and where it's going. That we were net down, losing $72 a day per patient day.
When we looked at that, yeah.
I mean, this is after IGT money coming in, we're losing $73 per patient day. I guess if you multiply that out, you realize that over time, and you do it now, it's probably a lot
Yeah,
of money every day, every year. It's just gonna keep going down, You think the IGT money should make you whole, but even the IGT money is off by $72 a day, and you got 240 beds times $72 times 360 days. It gets to be a big number of a hole we're digging for ourselves. We have to keep an eye on that.
and those costs, those costs
Yeah.
do include.
Has that number gone up? He said it's always been. Has that number gone up or down?
It does go up and down. I have to carve out, though, when I look at it, I have to carve out the OPEG entries because those are paper entries. And so what that does is inflates the cost per day.
Okay.
So I do look at that. We look at that regularly. I kind of track like how much the cost per day is, what the revenue is, and we can break it down like public nursing home revenue, kind of like the financial when you look at it. But those numbers do include the OPEG, which are very large numbers where there's no funding liability at this point. But we are required to report those on the financial
And that
statement.
causes us something to do.
It inflates that number.
So how do you pull that out? And say, well,
We carve it out ourselves, yeah. I don't, but I can let you know what that is. Yeah,
It just occurred to me that you kind of hope that it was all kind of balancing out in the meeting, but you want to look
Yeah.
at this and say, what's going on?
when you look at the financials, because of these reporting requirements and those GASB regulatory requirements, and it's not just Valley View, it's all,
Oh, it's everybody.
yeah, it's everybody. It really, if you're not involved with the financials, it's hard to kind of decipher what is going on there, because those entries are large entries. And I think in Brian's report, if you look there, he broke that out for you. He showed you, like, this is the facility's loss with these. And then here's what we look like without those entries. And I think I'll look at that and I'm gonna let you know in the next meeting what that number was, and I will look at the cost per day. And I will carve out what that number is.
Because if you look at the monthly report that you use, we're growing up in terms of number of Medicaid cases, 77 admissions. Medicaid cases was 74% last year.
Right.
And that, that's the one that we heard was like, we're losing $250 a day, or 400 to 600 or 500.
I'll report
That's a
back
big
on
bite.
that, yeah.
Go. You gotta provide services, but you gotta keep an eye on where are we going, is there a way to balance that out, so that you don't keep losing money.
Yeah, and there's gonna be a lot of unknowns as a result of,
Nobody's fault, we're not blaming.
Oh,
them.
no,
That's just the way
no.
it is everywhere.
no, and this has been, historically, this has been consistent in the facility. The Medicaid component that we're reimbursed does not cover the cost per day. So you have IGT, that's recognition for the county homes, that our cost base is higher from a labor and benefit component of it. But we're also operating on a Medicaid rate that is calculated based on 2007 costs. That, there's no business in the world that can operate when you're operating on 2007 costs that at one point, there used to be a trend, and you probably remember there was a trend factor. So there would be an inflationary factor done to the Medicaid rate, and they removed that. And then in the course of the last couple of years, we've gotten more, not necessarily in the component of the rate, like we did get that one increase of 7%. But this year in our 2024, we got a couple of like one-time supplemental payments of 1.2 million. So the problem has remained the same for years. The Medicaid component of the rate does not offset the cost to provide the care. It does not, and they need to do something and fast forwarding those rates and stop calculating them based on a cost base of 2007.
Do you, one more just question, do you guys know or have the data on, of the admissions, the nursing home residents? How many of those admissions have Medicaid trusts? You know that?
I don't know. I mean, we may have some analytics on that. It really depends on that type of admission, right?
Sure.
I mean, if somebody has a Medicaid trust, when they go to apply for Medicaid, depending on when they created that trust, right? If it's if it's outside that 5 year, then they're good. But I don't know if we really track like that, but I'll look into it.
It's interesting because
Yeah.
that contributes to it. That number's going up, or people are going up because they got.
Yes,
No.
that's
Okay,
true.
Thank you.
Thank you.
Motion to adjourn. Thank you very much, Donna.
Thank you.
Have a
You have a
second?
Medicaid trust?
Have a good evening. Thanks.
You're a good guy.
Thank you.
You're not making your neighbors.
Oh, yeah.
Not yet.